Okay, today we're going to hit on some health and gender inequities in terms of population, and then also look at something in terms of diseases before we move on to key issue 4. So this is chapter 2, key issue 3. And so there you see in China and India, they have a preference for male children. And so around 700,000 baby girls are missing, right? And so this means a couple of different things, right? Either um, they are aborted because you've got sexually selective abortion. You might have what's called female infanticide, where if a baby is born female, they will kill that baby right away. We're actually going to read something about that this week. And then these also, especially in China, these are a reflection of that one child policy, right? So because they had the one child policy, um, they wind up preferring boys and then also killing girls for that. And so this is kind of an unintended consequence of that one child policy. Um, so there are more boys than girls, so 105 for every 100 females born. That ratio tends to balance out by the time those groups get to be about 20. Male children are much more susceptible to certain diseases and then also kind of like crime and stuff that happens to younger people. When you look at China or India, where you see them having a whole bunch more males than females, that's because of this kind of preference where we might be killing babies or also having those sexually selective abortions where if a woman gets an ultrasound and they see that the baby is female, they might elect then to have an abortion. Okay, and so there you can see places where you've got, differences in terms of sexual selection. And so, like, if you've got that 110 and above, that's showing you places where you really have an unnatural amount of boys versus girls when those babies are being born. So you can see countries here, like India, which kind of goes around there, Vietnam here, and then also China and Taiwan to some extent. Others, a little bit less. You've got kind of the Soviet Union and some places in Eastern Europe, while these purple countries are, below average, where you've got more girl babies than maybe you'd expect. Although usually those aren't too drastic. Okay, so maternal mortality rate is how many women die in childbirth for any kind of reason, medical reasons, or also, you've got management issues. So, like, did the hospital do the things right? Um, so, in 2015, maternal mortality rate is 216 per thousand in the world, but it's only 8 in Europe. And so you've got a lot of countries, especially countries that, kind of like what we saw before, where they don't really respect women and don't want women babies. They also don't treat women very well in terms of pregnancy. And so you have a lot of women that are dying in pregnancy in some of these places. And so, like, you can get that maternal mortality in Europe down to 8 per 100,000 pregnancies, where it's really low. The United States, partially because of the way we do healthcare, has a higher maternal mortality than other developed countries. The rate has actually gone up, and the rate is especially bad for African American women and also poor white women have very bad maternal mortality. The United States, the way we do healthcare, tends to be very unequal in terms of who gets healthcare and how. And so there you've got maternal mortality rates. Maybe you'd expect, right? Sub-Saharan Africa has really high maternal mortality rates because there's not a lot of doctors per person. Afghanistan as well as Yemen, right? These are two places that are currently in pretty big conflicts. The United States is below 20, but it's still higher than you'd expect for a developed nation. Another statistic you've got is the infant mortality rate. So this is how many babies are dying under the age of 1. And so, like, a lot of times, if you've got a higher infant mortality rate, you're also going to have a higher birth rate because the babies that you have aren't guaranteed to survive. That's usually expressed kind of like the birth or death rate as per 1,000 births. And so again, we see in sub-Saharan Africa, you've got a higher maternal or a higher infant mortality rate, and then also high infant mortality in Pakistan and Afghanistan and Uzbekistan, and then pretty high over there in Papua New Guinea as well. And again, these places are also likely going to have high birth rates because they can't guarantee that the children are going to survive. And this is really a factor of how good is your healthcare system. And so in places that don't have a lot of doctors, that are facing a lot of disease, some like AIDS or malaria in Africa, you're going to have a pretty high infant mortality rate. And this is something we kind of talked about a little bit in terms of population pyramids and where those issues are coming. And so basically, you've got what's called the potential support ratio or the dependency ratio, which is looking at how many working age people are there to support the young, and then also how many working age people are there to support the old, right? So if you've got that wide base on the population pyramid with lots of kids, it's going to take a lot of people in the middle to make sure that they're educated. So if you've got a lot of kids, it might be hard to educate them. Whereas if you have a lot of elderly people, and you've got that wide top on your population pyramid, then it's going to be difficult to support the elderly in terms of that. And so here we've got number of working people divided by the overall ages above. And so like by 2050, the world is expected to only have 4 people working per the people who aren't working. And so that can make it really difficult to support the elderly. Again, kind of that population pyramid going through there. Do we do this? Kind of going through the different kinds of population pyramids there is going to tell us, where the gender is and where those equities lie. Life expectancy, how many years is someone expected to live? All right, notice you've got different life expectancies, and so this is another place that the US is kind of falling behind. Maybe look and say, hey, what's wrong with our healthcare system? That our life expectancy is less than almost every country in Western Europe. It's less than Canada, it's less than Australia, it's less than Japan and South Korea and Taiwan. What are we doing in the United States that makes it so our life expectancy is a lot lower? If you look in Europe versus then sub-Saharan Africa, where they have the life expectancy of 60, one of the reasons that you've got such a low life expectancy in sub-Saharan Africa is that you've got such a high infant mortality rate. And so that drops that life expectancy way, way down. Right? Healthy people in Africa can still live a very long time. It's just that there's a lot more diseases that they have to deal with and a lot more adversity that they have to deal with, so they're less likely to live that long. Kind of that dependency ratio, how many people are too young or too old to work compared to the number of people that are working. They kind of assume that you're going to work from 15 to 65. So how many people in that range are working, because they're the ones that are going to have to support the young, and they're the ones that are going to have to support the elderly. For the elderly, we're looking at how many people are working versus how many people are older. And so that can cause issues with taking care of the elderly as well. So health conditions kind of very different around the world. So different resources, depending on people are sick, different amounts of doctors, different amounts of access, different amounts of money are spent. So developed countries, the ones like kind of Western Europe, parts of South America and North America spend more, but then they also spend a higher percentage. And the state or the country that spends the highest percentage on healthcare is the United States. And the United States has that higher percentage, even though they don't have as good of outcomes. And so here in private citizens, about 55% of our uh, paying 55% of healthcare, which is a lot closer to developing countries than it is to developed countries. Most developed countries around the world basically provide free healthcare to people who need it. And there you see kind of the expenditures. The developed countries, of course, spend more on healthcare. That kind of makes sense. A lot more doctors in Europe, 30 per 10,000 in the population versus 5 in sub-Saharan Africa per 10,000. So that's just not a lot of doctors. It's hard to get to somebody who's actually a doctor. Developed countries, governments basically have to decide: are we going to raise taxes, um, or are we going to reduce medical benefits and things like that? And so, like, that's a lot of times what happens in the United States is like, if we're going to provide health care for everybody, then we're going to have to raise taxes on everybody. The United States does provide health care for all of its elderly. It's called the Medicare program. And for a lot of low income, especially kids, there's a program called Medicaid where the government provides health care. And so that's physicians per 10,000. Notice Western Europe, um, Australia, Argentina, all have more doctors per 10,000 than the United States does. Okay, so with disease, and this is something that goes as well, we've got something called the epidemiologic transition, where as society moved forward, they had different kinds of diseases that they had to deal with. So stage one is called pestilence and famine. There's a very high crude death rate. There's a lot of infectious and parasitic diseases. So like bacteria is causing a lot of deaths because people didn't really understand how bacteria worked. You've got the Black Plague, which is, migrating rats and happens at different times in China and the Middle East and Europe. It actually wound up killing about a third of the people in Europe. And so it really wrapped the demographics of that. We haven't had a disease really that changed demographics in the way that the Black Death had in a very long time. The last one was the Spanish flu. We'll see what happens with COVID and whether or not that really drastically alters the population. So eventually, people start figuring out that cleanliness is going to avoid pandemics. Again, pandemics, what we're going through now with COVID, a disease that occurs over a wide geographic area and affects a lot of the people. So cholera, which we looked at earlier, was contaminated water. And when people figured out, hey, we need to have clean water, then cholera kind of went down. And so that was like early stage two, is that of the demographic transition. Once we find out about the kind of cleanliness idea, cholera is hitting us pretty hard even still then. But then we figure it out and we can go through another part of the epidemiologic transition. And so here you've got cholera. Where do we have cholera? Places where people don't necessarily have clean water. Again, sub-Saharan Africa. Haiti had a huge issue, especially after that earthquake that happened about 10 years ago. And then India and some of these places in South Asia also have pretty high cholera um, instances. In India, there's a resistance to like using toilets because people don't want to, um, use actually have to clean them out. It's part of the caste system that people don't want to clean out toilets. And so people in India still, it's a big issue, is they go out and they will go to the bathroom in like fields. And when they go to the bathroom in fields, it causes like the runoff might contain cholera, and then that gets into their drinking water. And so that's one of the reasons that India still has cholera today. We did the whole thing with John Snow and the cholera epidemic, where he made a map that one of the first kind of geographers kind of solving that problem was Dr. Snow, figuring out that this one pump on Broad Street was contaminated. So we've kind of gone through that. And there's that map we looked at. We can see the Broad Street pump is where most of the cases are. We decide that, hey, we probably shouldn't be getting water from that pump. And then we have solved kind of the case there. Stage 3, so we figured out that bacteria and viruses are causing lots of deaths. We figured out how to kind of stop them with antibacterials and keeping things clean and washing our hands. And now we get different kinds of diseases that maybe weren't around when a lot of people were dying from those infectious diseases. So you've got cardiovascular diseases like heart attacks and strokes. And then all the cancers now that are coming about, like there's a lot more cancer out today and a lot more people die of cancer than, 100, 200 years ago because they're not dying of those infectious diseases. So a lot more people are getting cancer. A lot more people are dying from heart attacks and strokes and things that are cardiovascular related. And there you've got, male cancer rate between the for the 100,000 in the population. Places in Europe, places in South America have pretty high cancer rates. One of the reasons in Europe and South America is you've got an aging population. So the more old people in that population, the more likely those people are to get cancer. Stage 4, basically we've figured these out. We've still got degenerative diseases. You might have an increasing death rate because people are getting older. And so basically we've got techniques to make it so cardiovascular diseases and cancers can be cured or helped out because of those medical advances. But you might also get, a lifestyle where people aren't moving around. I'm standing today because I got tired of sitting. Um, and so you've got an increase in obesity that then will lead to more of those cardiovascular diseases. And so, in terms of those delayed degenerative diseases, how many people are dying, and then also the percent obese. Notice United States and Canada and some of those North African countries and Saudi Arabia have a large percent of the population that is obese. Um, and then Mexico is rapidly approaching. I had seen somewhere that I thought Mexico was actually as obese or more than the United States. But right now, the US is the most obese. One of the reasons is the kind of food a lot of people eat, which is processed. So, one of the things the government did is it made it so corn was really, really cheap to grow in the United States. And when they made corn really, really cheap to grow, people started to put high fructose corn syrup in like everything. So, like soda and chips and all of these different things that we're eating that are overly processed and cheap are also not really good for us and can lead to obesity. And so, like, the United States is one of the first countries ever where, because food was so cheap, more people who are obese are in poverty than wealthy. And so it's been a big kind of switch in that kind of demographic.